Really happy to see the extraordinary turnout we have. I'm going to introduce our next speaker, but before I do that, I'm also going to say thank you to a few folks who've made this possible. For the support of research and the team that's mostly sitting at this table, I want to say thanks to Centene. And for those who support the Right Care Initiative operations, I want to say thank you to Boehringer Ingelheim, to Genentech, the Health Services Advisory Group, to J&J, to Novo Nordisk, to Ralph Groceries, and of course to the Sierra Health Foundation, our host today. Hetty already mentioned LA Care is providing continuing education. I'm just going to remind you, and hopefully more than one time, to make sure you fill out your form. So now it's my great pleasure to introduce Shelley Rouillard, who is the director of the California Department of Managed Healthcare. Most of you probably know her. She has a long career as a patient advocate, working in a number of organizations before she moved to the Department of Managed Healthcare. She's had his boss.
Nobody's had his boss.
And it's our real pleasure to have Shelley with us today. So Shelley, please.
Okay, thank you very much. So I wanted to also welcome you today and thank Professor Blair Lewis for her rousing call to action on healthcare disparities. As Dean mentioned, I'm Shelley Rouillard, Director of the Department of Managed Healthcare. So today we're going to be hearing a lot about the progress being made in improving outcomes for consumers with diabetes or who are at risk for heart attacks and strokes. And while you will see that there's been many improvements made, we still obviously have a ways to go. I also want to thank our hosts here at Sierra Health Foundation and all the staff who worked so hard to put together today's summit. Carla Verdi, Amanda Liu, Brian Vong, Kyle Sheffield, and Liz Helms. Thank you all for your work today. Really appreciate it. And of course, the Right Care Initiative work would not be what it is without Hattie and spearheading all of this. And as Professor Lewis mentioned, you know, her enthusiasm and passion for this work is immeasurable, and she's a force of nature. Great job, Hattie. Thank you. So we have a phenomenal lineup of presenters today who will share the amazing work that's happening around the state to improve enrollees' health outcomes. So this is a unique public-private partnership between the state of California, the Department of Managed Healthcare, UC Berkeley School of Public Health, and other UCs, Stanford, USC, RAND, the Health Services Advisory Group, patient groups such as No More Broken Hearts and the Chronic Care Coalition, and most importantly, the health plans we regulate and their contracting meta groups. All of this work is helping to catalyze a great deal of positive action to improve enrollee outcomes. Through concerted collaborative effort built on improving the critically important clinical performance measures for blood pressure, cholesterol, and blood sugar, it's achievable to drive down these deadly and disabling cardiovascular events to save lives, improve health outcomes, and conserve scarce healthcare resources. Some of you may know that the department is soon going to be announcing that we've hired a chief medical officer. It's a position the department hasn't had since 2004, but given all of the changes that we've experienced in healthcare, we thought this was a good time to add this important clinical capacity to our department. Part of our chief medical officer's job will be to help me craft a quality improvement program for the department to hold plans accountable for clinical quality performance in key areas. But let me just assure you, we are not going to be creating any new measures, okay? As always, we'll continue to work with our stakeholders on this project and look forward to engaging with many of you on this new initiative. So we have a very exciting day planned today. We'll be giving out awards at 4:30, so hope you'll stick around for that and the reception afterwards. So thank you all for all your work to continue to improve enrollee outcomes. Thank you.